This podcast is brought to you by Carvana. Got a car to sell but no time to waste? Hop on to Carvana.com to get a real offer for your car in seconds. All you have to do is enter your license plate, answer a few quick questions, and if you accept the offer, Carvana will pay you as soon as you hand the keys over. They even offer same-day pickup in many cities. Save your time, score some cash, and sell your car the convenient way to Carvana. Pickup times vary. Fees may apply.
Ryan Reynolds here from Mint Mobile. With the price of just about everything going up, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.
This episode is brought to you by Polestar. There's only one true way to experience the all-electric luxury SUV Polestar 3, and that's to take a test drive. It can go from 0 to 60 in as little as 4.8 seconds with the dynamic handling of a sports car. But to truly understand how it commands the road, you need to be behind the wheel. Up to 350 miles of range, the 3D surround sound system by Bowers & Wilkins. It's all something you have to experience to believe. So book your test drive for Polestar 3 today at polestar.com.
Hey business owners, we know you know the importance of maximizing every dollar. With the Delta SkyMiles Reserve Business American Express card, you can make your expenses work just as hard as you. From afternoon coffee runs to stocking office supplies and even team dinners, you can earn miles on all your business expenses. Plus, you can earn 110,000 bonus miles for a limited time through July 16th. The Delta SkyMiles Reserve Business Card. If you travel, you know. Minimum spending requirements and terms apply. Offer ends 7/16/25.
Your burger is served, and this is our finest Pepsi Zero Sugar. Its sweet profile perfectly balances the savory notes of your burger.
That is one perfect combination. Burgers deserve Pepsi.
Welcome to the HCI family of podcasts. We're your source for personal, professional, and organizational growth and development. We share our own original research, explore industry trends, and interview executives and thought leaders from across the globe. Join us for practitioner-oriented content around all things leadership, HR, talent management, organizational development, and change management. Maximize your personal and organizational potential with the HCI family of podcasts.
Jonathan Hunt Glassman and Joshua Lee, welcome to the conversation today.
Thank you for having us.
Yes, thank you. It's a pleasure to be with you. You're joining us from the New York area. I'm south of Salt Lake City in Utah. And today we're going to be talking about digital health innovations in addiction treatment. This is a super important topic, generally speaking. I mean, just from a societal perspective, this is something that we need to be thinking about. We have lots of people who are struggling, lots of people who need this sort of support, this sort of help. But also, from the perspective of this podcast, as we're talking about organizational leadership, people management, we're talking from a business perspective, how do we help our employees? How do we help and support people within our organizations? And we know that we have lots of people within organizations that struggle with a whole range of different types of challenges, different health issues, different addictions, different health related challenges. And certainly alcoholism and other forms of addiction are among the challenges that they face. And so as organizational leaders try to put together benefits packages and other treatment, arrange an array of treatment options for employees, it's important for them to consider these types of options as well, which may not be the first on their mind. So I think it's really important to have these types of conversations. As we get started, I wanted to share Jonathan and Josh's bio with everybody. Jonathan Hunt Glassman is a healthcare entrepreneur and CEO of Oar Health, an addiction recovery platform that is revolutionizing the way people approach alcohol use disorder treatment. With over 15 years of experience in the healthcare industry, including strategic leadership roles at Humana, Optum, and Bain Company, Jonathan combines his expertise with a personal journey of overcoming alcohol addiction to make a meaningful impact in the field of addiction and recovery. Joshua Lee specializes in medication-assisted treatment of alcohol and opioid use disorders. He conducts clinical trials and treats patients struggling with addiction as a primary care physician. As a professor at NYU Grossman School of Medicine, he leads the Addiction Medicine Fellowship and conducts research focused on justice and community outcomes. So I'm super excited to have both of you sitting down with me today as we explore Oar Health, your addiction treatment approach, and how we can utilize this within organizations to help employees who may be struggling with alcohol abuse and addiction, opioid abuse and addiction, and these sorts of challenges. Anything you would like to share by way of your background or personal context before we dive on in?
I think that's a great tee up. The last time that the government estimated how much alcohol use alone cost employers or the economy at large, it was in the neighborhood of $250 billion. And that's before a lot of innovation. And that comes not just from healthcare costs, but the cost of absenteeism, the cost of employees who aren't fully present at work, all of the associated HR issues that can occur. So it's certainly our perspective that helping employees who are drinking too much or misusing any substance is an important one for organizational leaders to have on their radar.
This message is sponsored by Greenlight. With school out, summer is the perfect time to teach our kids real-world money skills they'll use forever. Greenlight is a debit card and the #1 family finance and safety app used by millions of families, helping kids learn how to save, invest, and spend wisely. Parents can send their kids money and track their spending and saving, while kids build money confidence and skills in fun ways. Start your risk-free Greenlight trial today at greenlight.com/Spotify. That's greenlight.com/Spotify.
Yeah, absolutely.
Yeah, I agree. And I think, addiction, alcohol use disorder, other opiate, others have really kind of lived in probably a kind of outsider stigmatized zone for employee assistance programs. And, it's one of those behaviors and mental health and health problems that, has its own checkbox, like when you have to do annual disclosures and stuff like that. And that's different than other healthcare problems. And then in contrast, large organizations have been happy to tackle smoking, which is less stigmatized, more clearly linked to higher employee healthcare costs and worse outcomes down the road. So that's probably what we're familiar with in addiction treatment within a large employment organization. Is kind of like a quit smoking program. And probably should be a lot more for mental health in general. Other behavioral health topics, but addiction, especially alcohol, which is ever present, is legal, is pretty much, nationwide. There's not a lot of variability in terms of the use and the burden of the problems, and it affects every kind of workplace.
Yeah, absolutely. And it's also important to note that alcoholism is protected under the Americans with Disabilities Act and the Americans with Disabilities Amendment Act. And so just like other forms of disabilities, other forms of addiction, this is something that is protected. And that's something that I think sometimes we don't consider, we don't think about. We think about, someone who's in a wheelchair. We think about someone who, has some form of physical disability. We might even consider someone who, has some form of heightened anxiety or mental health issue. A lot of times we don't think about something like alcoholism, or we might think, well, that's their problem. That's their that behavior that they need to just deal with. And it's a diagnosis, like it's a disease, and it's something that is protected under the law. And so it is something that organizations have to grapple with. And we could debate it all day long whether or not you think it should be protected, but it is protected, and so it's something that we have to grapple with, right?
For sure. And then I think the kind of fun message that we can deliver is that there's a lot of innovation, and it's really quite simple to get started with treatment and help. And perhaps again, akin to smoking cessation programs, like there's a couple ways you can approach it. Not everyone has to do it the same way. A lot of this can be delivered at home in complete privacy. You don't have to take 2 months to go to a rehab and not be in the workplace. And that's the other thing to realize, that there's a lot we can do while keeping people in place and productive, and they can start to work on this, much like you might learn you have hypertension and start a medication for hypertension, but you wouldn't miss a day of work, but that's an important health problem you need to work on, in the coming years and maybe lifelong. But it doesn't necessarily have to be like the kind of before I got help and now I got help and I'm totally different. People can really maintain their careers and their productivity while getting help.
Yeah, and like you said, Joshua, it's kind of ubiquitous. Like alcohol in the workplace is something that we see all over, and maybe not to the extent in the US as we see in some other international countries, cultures. I worked, for example, for an extended period in South Korea. The drinking culture in South Korea, compared to the US is definitely at a different level. Like they like their alcohol in the work culture, and every day they work long hours and then they love to go out and they love to hit the bars and they love to drink, right? So, I don't actually know the numbers, but my suspicion is that the level of alcoholism among, South Korean men, corporate men is probably at a much higher level. I don't know if that's true, but
I believe it is, and I believe it skews heavily men versus women in a lot of Asia and South Korea in particular, and then it corresponds very highly with smoking rates. So
yeah, well, that would be my suspicion from my experience. Anyways, so the point is, when you go to other parts of the world, this is also an issue, but still in the US as well, like it is absolutely something that we're going to see in many instances in our very own companies. Certainly, as we travel around the country, as we travel around the world, we're going to see it. And so it's something we can't just ignore. We can't just pretend like it's not there. We can't just, pretend like it's just their problem and it's not something we have to deal with. Coming back to my point about the Americans with Disabilities Act, we have to address it. And if we don't address it, not only are we not doing, our duty, I think, as an employer, but we're also going to be held legally liable. Like there is actual, liability involved and those sorts of things. So something to consider. Jonathan, why don't you start to walk us through, like, what does it look like at Oar Health? As I was doing the introductions, there's this digital health innovation approach that you're taking to addiction treatment. Walk us through what that looks like at Oar Health. I know there's lots of innovations in the space. And what's your approach?
Or makes access to a daily pill to drink less or quit simple. The way that it works is folks can come to our website, OAR Health, oarhealth.com, learn about alcohol use disorder, which is the modern medical term for the condition. Learn about medication-assisted treatment, which is one of several evidence-based approaches to treating alcohol use disorder. We don't take for granted that either one of those acronyms is a household name. And then if the individual feels as though MAT might be a good fit for them, they can begin an online consultation with a doctor or nurse practitioner licensed in their state. Get a treatment plan that includes recommendations and, if appropriate, a prescription, most commonly for naltrexone, which is the frontline medication for the treatment of AUD, and even get that medication shipped to them from one of our partner pharmacies so that they can get started from home within a few days. As you said, we really see Oar as part of a broader landscape of online and digital tools that make access to the evidence-based treatments that in many cases have existed for decades, makes access to those more accessible, more convenient, more private, simpler.
So how have you seen this adopted? I mean, clearly individuals can use this, but how have you seen this adopted in organizations, by employers, by HR departments as a benefit?
We think there's a long way to go. We have worked with a partner to advise employees that they can often use their HSA or FSA benefits for the services that Oar provides. But we ourselves are not a kind of covered benefit at any employer. As of now, we hope we're a back pocket option for HR
Mm-hmm.
professionals who are having difficult conversations with employees that they're attempting to assist. And then there are, certainly employers that have adopted solutions like Pelago, used to be called Quit Genius, as an addiction treatment benefit. And then it's worth saying that access to medication to drink less or quit can often be accessed without any sort of specialty solution. As Josh can talk more about, any licensed prescriber in the US can help someone get started with a medication to help them drink less or quit. And that, of course, might very well be within the four walls of the health insurance benefit and the pharmacy benefit.
Our opportunity, I think, for Oar as more of a direct-to-consumer product is that largely does not happen. Like historically, you go to your doctor, they don't ask about drinking. You mention drinking, they don't follow up. They don't administer some pretty simple screeners that we encourage every kind of healthcare encounter at least once a year for a U.S. adult to use to start a conversation about alcohol. And it doesn't have to lead to treatment or anything dramatic, but it's something, that it's as widespread and as potentially damaging that it meets criteria for like everyone, kind of like blood pressure, like you should have it checked once a year. But that largely doesn't happen. And then doctors, if they are kind of confronted, and this, I include PAs, nurse practitioners, everyone kind of in the GP, primary care, emergency room workforce, they often don't know what to do. They're not trained recently enough or ever in kind of the use of medications for alcohol use disorder. So it's both the like kind of societal kind of ignorance or stigmatization, and then also like within the healthcare professions. And what we try and do, and part of my job at NYU is like train people better, and so that the next generation is ready to tackle these problems right away. But they kind of lack a confidence and skill set to then do anything about it. So Oar has tried to like get into that space and say, we know what we're doing, and this medication, naltrexone, is quite simple and safe. It happens to be a pretty old, generic, inexpensive medication. So all that fits with kind of the model we've built and why we think it's important for us to keep going, just reaching individuals. But organizations could make the same decision, especially organizations that know they have a high burden of alcohol disease. They could be a little more aggressive probably in terms of looking at solutions like ours or our competitors or any other type of access and kind of availability push, because it's really not hard to treat a lot of people with these types of medications that don't always work or work for everyone or work the same way. So you do want to kind of have some kind of opportunity for longitudinal follow-up and trying different things. And probably for some people, they'll need years of work. For other people, it's something they can get better right away and keep it that way. But, the usual story with addiction and alcohol problems is it does take several tries, kind of like quit smoking, or it doesn't necessarily worsen, but it doesn't necessarily get better year to year. And it takes several years of kind of sustained energy and effort and attention to get somewhere. So it's not going to work the same for everybody and each individual. And what we do with Oar is kind of one version of that. But the more employers can kind of think about this as start simple for everyone and then have other capabilities for more complex problems is probably the way to go.
I'm completely ignorant in this space. I'm not a drinker. In fact, I've never had alcohol. So I'm just not a drinker. And when I go to my annual physical, my doctor always asks the question, do you drink or smoke? And I don't. And so I just say no, and he moves on, and then we go to the other parts of the physical, and he checks on other stuff, right? So I have always just had the assumption that for people who do drink and smoke, that there would be then other questions and follow-ups and like a whole series of other things. But what you're suggesting is maybe that doesn't happen. Like maybe there actually isn't other screenings and follow-ups and like other stuff that normally typically just would happen as due course in like annual checkups. Is that the case?
Yeah, it sounds like you're getting pretty good evidence-based screeners. We could look at the exact questions they're asking, but they probably adopted good stuff, and that probably indicates a more high-quality kind of healthcare institution and practice that you're interfacing with. The national numbers for is everyone getting that same thing that you're getting are lower. They're not as they're not as robust. And then it can, it can be a little nuanced. And of course, like people who are not ready to talk about their drinking, you do need to kind of stop and ask those questions in a potentially kind of non-judgmental, thoughtful way that you don't always get from that form or from that waiting room clipboard or the doctor itself, who kind of wants you to say no because they don't have much time. They need to get through this visit, and that so then you can get a lot of false negatives. People would, in the right setting and with the right partner, they would talk about it, but they're just not going to, because they're not sure what to do. They don't know what you'll think of them. They're worried. They're already kind of ashamed and guilty. And they would probably be relieved to talk about it, but you miss the opportunity. So then the rate of that happening is substantial. Yeah. And then if you said, yeah, actually I drink 7 beers a day and I actually want to cut down, but haven't been able to, is that doctor or office ready to like help you? Or do they then say, oh, we're not sure what to do with the yes, or our algorithm says go several miles away to some social worker or treatment center. And then the rate of you doing that is even lower. So like, net, a lot of people fall through the cracks and really don't get evidence-based care that deserve it and would otherwise probably accept it if it was packaged in the right way. And that's healthcare. We don't have enough time. Reimbursement is something doctors always complain about. And there's a million other things we need to do that are also important. And so maybe you do need, for kind of each popular but hard to reach sometimes condition, stuff like OR, which is like, we're gonna do that. We're gonna kind of come up with like a marketing strategy and outreach. You could build it into your employee kind of environment, or it's something people find on their own. But not enough of it has happened historically or currently, and that's why we're doing what we're doing.
Can I also ask, and I note the time, I'm going to have to let you go here in a little bit, but maybe one more question. And maybe this is not an either or, it's a yes and kind of thing, but this medication that we've been talking about, how does this complement perhaps or compare to like 12-step programs, residential treatment programs when you're going, off for, those types of programs? How does this fit in with those types of treatments?
Yeah, it's totally complementary. There was this kind of lore, like you need to go to AA and you don't really get medical treatment for alcohol. That was kind of a very common approach, say 1970 to on, the years before and the years after. And I think our more modern contemporary understanding is there are medications. There are 3 of them that are labeled for alcohol use disorder. There's a couple others that might be effective as off-label products. They're all fairly straightforward and safe and easy to take, with one exception called disulfiram. I don't want to get too tangential, but there is one medicine that's quite kind of unique and a little bit hard to manage. But we're not talking about that. We're talking about, in Oar's case, naltrexone, and then in the case of everything else you can take, a couple other ones. And those can complement my going to a rehab center, my doing 6 months of aftercare with a intensive outpatient program, my starting the medications while getting help from a private therapist, my being in a kind of more public sector program with some groups and some art therapy, and then if you need to see a psychiatrist or medical doctor, that might be available and they might prescribe this medication. So it's actually highly complementary to most of what you think of as specialty addiction treatment. It's complementary to 12-step, which is not actual billable treatment, but anonymous, confidential, community-based peer support. And it's highly complementary to other medical and psychiatric treatment you might be doing, or other behavioral therapies. So it really doesn't confuse anything. And it's something we encourage everyone to kind of explore, all those things that can help them. Not everybody wants to go to AA or 12-step. Not everybody wants to try medication, but AA really clicks with them, and vice versa. So you really just have to do kind of a, spaghetti on the wall, see what sticks for that patient give them their options, educate people about kind of expectations and what they might experience, and then just see what they are motivated to do, what clicks with their own kind of circumstances, personality, preferences, and go from there. And you don't have to try things in any particular order. So it's really not like dogmatic, and you can really kind of blend it all together creatively and depending on the person's circumstances.
Yeah, awesome. That's great to hear. And I'm no medical professional or psychologist or anything like that, but as you're describing this, I'm thinking, in comparison to, like mental health challenges, and you have talk therapy, and you have psychiatrists and psychologists. You have all sorts of different medications, right? And they're not mutually exclusive. Like you can 100% take different medications in combination with each other and go to talk therapy and therapy groups and do art therapy and like all these different things, right? And I think over time we've gotten to the point where at least it's less stigmatized than it was a couple decades ago. And what I'm hearing from you is like, let's try to get to that place with addiction. Like maybe we can get to the point where we can have medications and we can have therapy and we can have 12-step programs and we can go to rehab and we can like do whatever makes sense for the individual to help them get the help that they need so they can beat the addiction. And when it makes sense, the employer can help provide that support, family and friends, community can help provide that support. Ultimately, we just want to help individuals get the help they need so they can live a happy and healthy life, right?
Absolutely.
Well, Jonathan and Joshua, this has just been a really great conversation. Again, I note the time. I need to let you both go and get on with your busy days. As we wrap up, I just wanted to give you a chance to share with the audience how they can connect with you, find out more about your work, your team there at Oar Health, and then give us a final word on the topic for today.
Sure. So folks can find both of us on LinkedIn or Twitter, and then find us, the company, at oarhealth.com, which links to all of the company's socials as well. Thank you for having us. I think we covered a lot in a limited amount of time. A few points that I hope came through. One, alcohol misuse and addiction more broadly is going to be experienced in any workplace or organization of any size, with significant potential consequences for the employee and the organization as a whole. Two, options to help those employees who are drinking too much or misusing any substance are quite likely to be more diverse and varied than we may assume based on what we've seen in the media or heard about ourselves. Three, HR leaders, organizational leaders can help increase the visibility of those options. And finally, if folks are interested in helping their employees get access to medication that can help them drink less or quit, one of the most underutilized, underknown of the options on that menu, we at Oar Health are happy to collaborate from the individual employee level to the organizational level and help in any way that we can.
Just echo that the treatment can be quite simple and more accessible than you think. And then it's on us, all of us, organizationally and then individually, to give it a shot.
Wonderful. Jonathan, Joshua, thank you so much. It's been a real pleasure. I encourage the audience to reach out, get connected, find out more about what Jonathan and Joshua can do for you and their workers and colleagues at Oar Health. And as always, I hope everyone can stay healthy and safe, that you can find meaning and purpose at work each and every day. And I hope you all have a great week.
Thanks for joining us for this episode of the podcast. We hope you stay healthy and safe, and please join us again soon.